This Christmas, New Year, Sankranti, Ziva Fertility offers you a 30% discount on IVF packages. To know more about this, please feel free to contact us on the numbers that you see on the screen or visit your nearest Ziva Fertility Center. Thank you. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Well, this is not clinical talk today. This video is not about some scientific or medical information that I want to give you. This is purely a counseling session. This is because a lot of patients that come to us when they are confronted with their problems with infertility, whether it is tube block or low sperms or quality of eggs are not good or sperms are not good, and when we suggest treatment options to them, that is when we tell them that it's better if you go for treatment options, whether it is low grade or high grade, they panic, they get worried, they think that they are taking injections and tablets which are not natural. So this video is basically a counseling session. This is just to throw light on how simple infertility treatment can be if you wish it to be. So yes, there are a lot of blood tests, there are a lot of scans, there are a lot of tests that we do for men also to understand where the problem is. Once we understand the problem, based on the problem, we give you the treatment options. Of course, the most important criteria is played by the woman's age. If the wife's age is less than 30, then treatment options are a little more flexible. But if she's advancing towards 35 and she's late 40, then we try to hurry up the procedure so that you can have quick pregnancy and a risk-free 9 months of pregnancy and easy delivery. So what are the treatment options? The first is ovulation induction. It's very simple. As you understand the word ovulation induction, the egg is made to grow and rupture and wait in the tubes. This is where tablets are given, scans are done on a regular basis, and by regular I mean 2 or 3 scans to see if the egg is growing, and the egg is released from the tubes and the egg is released from the ovaries by an injection. Once it waits in the tubes, we ask you to have intercourse around that time so that there are sperms present and the chance of fertilization and embryo being formed is more. So this is ovulation induction, and if you are less than 30 years old, this can be performed about 3 to 6 times. Then we come to IUI, intrauterine insemination, which is much similar to the ovulation induction protocol that I told you, just that maybe a few injections may be given, tablets doses may be increased. The scans are also done similarly, but what is different is that on the day that the egg ovulates or it is released, your husband's or partner's sperms are taken, they are purified, as in dead sperms are removed, poor motility sperms are removed, only functionally motile sperms are taken and inserted into your uterus. By this, the success rate increases from about nothing at all to 15 to 20%. Of course, all this depends, as I said before, on the woman's age. So this plays a very critical role. And when this is done, if you're 30 years or less, this is done about 3 to 4 times, this also fails, then we move on to IVF. The previous two procedures, ovulation induction and IUI, relies heavily on the tubes. That is, the tubes have to be open. Only then this procedure can work. IVF is a procedure where eggs are taken out, injections are given in higher doses, eggs are taken out under anesthesia, they are mixed with your partner's or husband's sperms, and embryos are created and put back into the uterus. It's a very simple technology. This is not very difficult, but trained specialists should be doing this. Fertility specialists give you these hormonal doses based on your response. The dose may be increased or decreased, and proper monitoring has to be done. So while I say it's easy, it has to be done by trained doctors only, and when done properly in a good laboratory with a good doctor, your chance of success also improves. So do not be scared when a doctor suggests treatment options to you or says that trying naturally will not work out, because remember, if you're 30 years or lesser, trying for 1 year with unprotected intercourse should have resulted in a success, because 80% people get pregnant. The next 6 months, another 20% will get pregnant. But if you are above 35, it's better to go to a doctor within 6 months of trying, because then investigations can be begun, and if there is a problem, it can be treated easily. So infertility treatment, or rather fertility treatment, is an easy procedure to do. Do not get worried or scared. Clarify everything with the doctor and definitely get treated for infertility. Thank you. A lot of effort has gone into making this video. Please like and subscribe us.